My name is Scott Angulo. I'm a respiratory care student here at Miami-Dade. I'm here to demonstrate EZ-PAP. The indications to EZ-PAP are patients with COPD, and it's also used to prevent and treat atelectasis. The contraindications are intracranial pressures that reach 20 millimeters of mercury or higher, patients with oral, facial, or skull trauma, or patients that are feeling nauseous. The hazards are if the intracranial pressures reaches higher than it's recommended, it will cause my patient to aspirate, vomit, or swallow air. So before I begin, I'm going to go ahead and check my physician's orders and make sure that it's directed. So I'm going to go ahead and wash my hands for 15 seconds and put on my gloves, and I can introduce myself into the patient. Now that I have my gloves on, I'm going to check my two patient identifiers, which consist of the medical record number and the birth date. Okay, now I can go ahead and gather my equipment. Okay, so it consists of the nose clamps, the filter and the mouthpiece, my manometer, and my oxygen hose, oxygen tubing, and my oxygen source with a Thorpe tube. Okay, so before I begin, I'm going to go ahead and do my vital signs, which consists of the pulse ox, respiratory rate, heart rate, and breath sounds. Okay, now I will demonstrate. My patient would demonstrate how to use EZ-PAP. Before we begin, we put on the nose clamps to make sure there's no leaks. I'm going to go ahead and connect my oxygen tubing to the oxygen source. And set the flow at 5 liters per minute. What she will be doing is she will take a deep inhalation, more than normal, and she would exhale slowly into the manometer. This has to be done 5 to 10 times within 10 to 20 minutes. Okay, you can go ahead and put on your nose clamps. Take a deep inhalation, more than normal. Put your mouth on it, and exhale slowly. The measurement should reach between 5 and 20 centimeters of water pressure. That would be the target. And like I said, it has to be done between 5 to 10 times within 10 to 20 minutes, and between that procedure is followed by 3 huff coughs. Okay, now I would turn off my flow meter. Okay, now I'm going to go ahead and do my vital signs again, my pulse vitals, which consists of pulse oximetry, respiratory rate, heart rate, and then the breath sounds. It's like, okay, so if she has any type of sputum, I would examine it for odor, color, thickness, and amounts. I'm going to go ahead and take off my gloves. Dispose of it inside the trash can. Wash my hands for 15 seconds. Ask if the patient, if she's comfortable, if she needs anything else, and I'll go ahead and chart what I just did.